Good morning and good afternoon to all of those who have joined us from across the Caribbean and across the globe. I hope that everyone is doing well. I'm Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition. I am incredibly excited about this special joint webinar the HCC is hosting in partnership with PAHO, Reopening Schools, Shared Perspectives on Navigating Mental Health During the COVID-19 Pandemic. This is the fifth in HCC's ongoing webinar series on COVID-19 and NCDs in the Caribbean. This webinar is being hosted on the heels of Caribbean Wellness Day 2020, held under the theme Power Through Collective Action, with the sub-theme Stronger Together 2020, in support of PAHO's Regional Mental Health Awareness Campaign. On September 30th, we will salute young people on Caribbean Youth Day. And in just over 2 weeks, the international community will celebrate World Mental Health Day 2020 under this year's theme, Move for Mental Health, Let's Invest, highlighting the severe under-resourcing of mental health and the urgent need to invest in quality mental health care for everyone who needs it. The coronavirus pandemic has caused tectonic shifts in the way we live our lives, creating such deep disruptions in every facet of our realities, including our mental health. A recent headline from The Economist referred to a pandemic of psychological pain and observed that not since the Second World War have so many people in so many places been traumatized at once. The impact of the pandemic has been particularly significant on children's lives and their education. In April 2020, UNICEF sounded an alarm, highlighting unprecedented numbers and dire implications as temporary closure of schools impacted more than 91% of students worldwide, around 1.6 billion children and young people. Never before had so many children been out of school at the same time, disrupting learning and upending lives. COVID-19 has radically transformed schooling as we know it, largely shutting down traditional face-to-face education and forcing children, teachers, and parents to struggle with an entirely new world of virtual learning. Significant uncertainty still looms as educational institutions across the Caribbean embark on the 2021 academic year. Schools have adopted various models, shift systems to reduce class sizes, staggered drop-off times and meal times, moving classes to temporary spaces or outdoor, and blending face-to-face and virtual learning, all of which can dramatically affect how students learn, play, and interact with their peers, teachers, and parents. These changes are compounded by the residual emotions linked to protracted lockdowns, which interrupted the school term preceding summer holidays and left many students, parents, and teachers mentally exhausted and frustrated. We are already beginning to see the negative mental health impacts on students and teachers in the school community. Guidance counselors designated to provide in-school support are often ill-equipped to handle the anticipated rise in mental health issues experienced by children. Children living with disabilities who very often require hands-on specialized care have also been negatively impacted. Parents and caregivers are also key actors in this new school system, playing new roles, navigating virtual learning, homeschooling, and providing holistic support for their children. And so this brings us to our webinar today, the aim of which is to explore the mental health concerns of key actors within school communities as they reopen across the Caribbean, and to discuss and guide strategies to cultivate school ecosystems that support positive and resilient mental health and well-being. And as I close, I would like to bring us back to the themes of Caribbean Wellness Day 2020 and World Mental Health Day 2020 within the context of school communities. How can we come together stronger as communities to invest in holistic mental health services which provide much needed mental health support to children, teachers, parents, caregivers, guardians, and employers? What lessons can we learn and what strategies can we adopt to safeguard mental health? We will hear all of this from our wonderful panelists today. But before I introduce our expert moderators, let me cover some housekeeping rules. Please use the question and answer box and not the chat box to ask panelists questions. And please indicate who the question is for. For example, Dr. Cayetano, what is, and your question. And please complete the post-webinar survey. And now I will pass the floor to Dr. Elisa Prieto and Mr. Pierre Cook Jr.
Thank you, Maisha, and good morning, everybody. It's a pleasure to co-host this session with HCC. My name is Elisa Prieto, and I am the NCD and Mental Health Advisor working at PAHO's Sub-Regional Coordination Program for the Caribbean. I'm based in Barbados. And a disclaimer for this webinar, I'm also a mom of two. So I'm very pleased to co-moderate with my colleague Pierre Cook. We have an exciting program ahead of us, starting with 2 technical presentations to help us set the scene by our colleagues Eldona Boisson and Claudina Cayetano, and then a panel with the real experts. We'll have parents, we'll have students, and we have a counselor. So really exciting agenda for us to cover. We already have 159 participants, which is great to see. And so without further ado, I'll hand over to Pierre so he can get us started. Pierre, the floor is yours.
Good morning, everyone. My name is Pierre. I'm the technical advisor at the Healthy Caribbean Coalition, and I'm also a law student. So I am also very interested to hear this conversation that we're having this morning. And for our first presentation, we're going to have Dr. Eldona Boisson, who's going to speak a bit about COVID-19 protocols and expectations, especially within the context of getting back into school. Now, she's an advisor on disease surveillance and epidemiology at PAHO, and I'm just going to invite her to share a bit about herself.
Good morning, everybody. I'm very pleased to be here with you this morning. I'm going to really focus a little bit on the face-to-face classes in the context of COVID-19. I don't see my slides. Okay, thank you very much. So yes, I work as an advisor in disease surveillance and epidemiology, but in the context of COVID-19, I'm also part of the incident management system team for the Pan American Health Organization, where I focus on public health measures and also surveillance of COVID-19. So I'm going to be focusing, as I said, on in-person classes in the context of COVID-19. Next slide, please. So in terms of returning to school in the classroom, not virtual as most countries have been having, what we're really aiming for is to ensure the continuity of safe, adequate, and appropriate educational and social learning and development of children. That's the main thing. But in the context of COVID-19, we need to maintain safety. We want to minimize the risk of COVID-19 spread within the school and any school-related settings, activities, and so forth. We want to guard against the potential for schools to act as amplifiers for the spread of COVID-19 in their communities. We've been hearing a lot about that of late. And we want to ensure that the school-related measures that are taken are integrated within the wider measures of the community and also support the wider measures. Next slide, please. So let's just quickly talk about COVID-19 amongst children. What we've seen so far is that children are not as affected as adults. So far, globally, about 8.5% of all the cases have been amongst children, which is a small percentage. Generally, disease in children is mild, but really, we might have some critical illness, particularly amongst children who have pre-existing conditions. We've been seeing of late, within the last couple of months, a multi-inflammatory disease that seems to be occurring among some cases, but still relatively rare. The role of children in transmission still remains unclear. We hear on some sides that children are likely to spread to adults, but then we also have evidence that suggests that children are less likely than adults to be the main transmitters of infections. We've also seen few educational institutions with outbreaks, occasional cases here and there, but few with large outbreaks. And the transmission, when it has occurred, seems to be primarily related to social events linked to the school or university, as opposed to within the classroom. And sometimes the introduction of the virus was even by a staff member rather than by a child. Next slide, please. So how do we decide, open or don't open for face-to-face classes? Well, we first of all must consider what is the local situation and epidemiology. We cannot just say we're going to open schools and do these things in schools and consider the school as a standalone entity. We have to consider what's happening in the wider community and what is already being done. So for example, if we have no cases or just sporadic cases here and there, we may find that we can consider it safe to open schools with specific measures in the school. However, if we have clusters of cases, bunches here and there, we might find that most of the schools open with measures in place, but maybe in some areas that are more affected, the school is closed and you do online perhaps. When you have community transmission, particularly widespread community transmission, we have to now consider a risk-based approach for opening schools. Should we be opening them at all? And we also want to consider what's happening outside. Is it a lot of cases increasing, hospitalizations, deaths? And if there are some schools that we think can be open, they must be using the COVID guidelines. So we have to consider first and foremost what's happening out there. What is the context in which we are considering to open the school? Next slide, please. So if we determine, yes, the community is in a situation where we can consider opening schools in some or all areas, we have to consider the capacity of the school to operate safely. Do a risk assessment for different parts of the school, the classroom, the library, the places where you have activities and so forth, and match your measures to the level of risk that you may be having. And you should maintain these measures as advised by your local authorities for all parts of the school overall, in the classroom, the individual child, the gym, the library, and so forth. Next slide, please. And what kinds of measures are we going to think about? First and foremost, physical distancing of at least 1 meter. Some countries are using 2 meters, that's fine, because we're talking at least 1 meter. Why? Because droplets of the infection tend to fall about 1 meter away. Use of masks is appropriate. WHO and PAHO, we don't recommend masks for children under age 5. Why? Because they tend not to use them safely. They touch the outsides, they move it around and so forth. And if you're using a mask badly, that puts you even more at risk of not using a mask at all because you're likely to contaminate yourself. And then for children between the ages of 6 and 12, use a risk-based approach. Weigh up whether the child is able to use the mask safely. You have to consider ventilation, preferably open windows rather than AC, but if you are going to use AC, make sure they are well functioning, being cleaned regularly and so forth. Hygiene, hand hygiene measures, environmental cleaning in the school, screening and management of sick students, teachers, and other staff. And that doesn't just mean taking the temperature, because COVID-19 doesn't necessarily mean that you have a temperature. Some cases do, some don't. So asking the specific questions, looking for some of the other symptoms other than fever alone. Ongoing communication with everybody, parents, students, teachers, other staff. Let them know what's going on, what you're doing, why are you doing it, what do you want them to do. Let them understand the individual responsibility of each of these different groups to maintain safety for everybody. And ongoing monitoring of school operations, checking to make sure that things are working well, checking to make sure your measures are in place, monitoring if you're getting sick persons within the school environment. But you have to do a continuous sort of evaluation of what's happening to make sure that what you're doing is working to deliver your curriculum safely and to make sure that persons are not getting ill. Next slide, please. And some final considerations. We normally have, for many of the countries in the Caribbean, a requirement for immunization before you enter school. Now, there's a lot of fear about going to health centers. People basically are very focused on COVID and not thinking about some of the other things that are still there. They haven't disappeared. And so therefore, you want to make sure that all the school entry immunization checks are still occurring, because these still have to take place. You should be frequently following up. Schools should be frequently following up and supporting students who are out of school, whether it is because they've become ill and they're at home, whether it's because they're at home because someone at home is ill, or because they're doing online learning. And to avoid penalizing or stigmatizing students for not being in class, because in this situation, there may be very good reasons for them not being there. Also, schools want to work with your social services to ensure the continuity of crucial services that take place at schools, like school feeding programs. For some kids, that's where they get their main meal. Counseling, health screening, and other supportive social services that would normally occur when children are in school. Next slide, please. So thank you very much for your attention. And of course, I'll be available at the end to take some questions. Over.
Thank you so much, Aldona, for that excellent presentation, as usual. We will be taking questions at the end of the session, but we would like to encourage you to use the Q&A at the bottom of your screen to start addressing questions to any of our panelists as the session unfolds. So next, I would like to invite my colleague, Claudina Cayetano, mental health advisor working for the Pan American Health Organization and stationed in Washington, D.C., to proceed with the next presentation, where she will touch on how mental health issues may manifest in the classroom, quote unquote, during this time, and also discuss some strategies to create an environment that is conducive to mental health resilience. So over to you, Claudina.
Thanks a lot, Elisa, and thanks colleagues for organizing this webinar. I am very thrilled to be part of this. I think it's definitely very important that we pay attention of the, about what about mental health. But before I start, one of the things that I caught my attention that I think is relevant for us to consider is the fact that before COVID, we already know what are the challenges when it comes to mental health. So we know that 1 in 5 persons may suffer from mental health disorders. We know that mental health conditions start by age 14, and suicide is the second leading cause of death in young people age 15 and 29. We also know that the expenditure on mental health in low and lower middle income countries is less than $1 as compared to high income countries where it's 80. So you see the disparity, you see the challenges that we're encountering. I also would like you to take a moment and think a little bit of what are the conditions of when it comes to school. How many schools have counselors, provide mental health services, have psychologists? So these are things that we need to be taking into consideration. Additionally, there's enough information for us to know that mental health matters and that we need to be able to pay attention on mental health. There's sufficient documentation. For my presentation, these are some of the documents that I use for the sessions and that you will be able to access when we share the slides with you at the end of these sessions. So important to consider what is the impacts of poor mental health in youth. So when you think, and this is why mental health matters, because we're talking about low educational achievement and dropout, we're talking about increased health risk behavior, we're talking about premature death, we're talking about the stigma, we're talking about bullying, we're talking about decreased daily life participation in society. And this is we're talking about the impact on the family, on the caregivers. So all of these needs, most times are unmet and they're not even being discussed. So when it comes to COVID, there's tremendous challenges for children, for caregivers, and in fact, even for decision makers. And the challenges are because, in trying to protect your families, in trying to hold some resemblance of normalcy, there is tremendous challenges on families in terms of how do you understand what you need to be doing to make sure that you adhere to the public health measures, to make sure that, we keep our children away from grandparents and then when you're being confined in the home, all these routines, all the changes, working from home, and if you need to be leaving the children with the siblings, all of these things are very challenges. And these have an impact on our mental health. So for decision makers, I think it's definitely important to understand, what are the learning and what are the best, how do we support children, how do we support them when they're in the classroom? It's also So when the impact of COVID on student achievement it's a concern not only for educators, it's concern for parents. And we know that now with the COVID, there is also concerns about the gap. There's a huge gap between high and low achieving students. And this is going to become even larger because it's difficult sometimes, especially if you have this blended learning. So teachers are scrambling to adapt the content for an online platform when it's online or blended, and parents are also juggling work responsibilities. If not, some parents are not working, are jobless, and with caring for and educating their own children. And we know parents are not teachers, so they are parents, but then with these changes now, you also have to take on that challenge. So there's a lot of complications. And we have to remember that students who feel physically and emotionally safe, they tend to do better academically. And this is the challenge that we are finding now. We need to think through on our children with disabilities. That's also another challenge because they have difficulties in keeping up with the prevention, the public health measures. They have specific needs when it comes to communication. Sometimes they need to touch the environment to be able to function well. So consideration has to be put in place for mental health and psychosocial support for children with disabilities. And even in supporting parents who have children with disability, that's definitely something very important. So what it is that, what we need to be keeping in mind when we're talking about, what are all these precautions that are definitely very relevant. Our priority clearly is, safeguarding lives, but definitely more importantly, paying attention to the well-being, not only of the children, but also of the teaching personnel. So I think this is very important. It was also mentioned already the importance of avoiding stigmatizing students or staff who may have been exposed. Because I think here what is relevant to remember is that COVID does not differentiate. It doesn't have any borders, no ethnicity, disability, or age, or gender. So education settings should continue to be welcoming, respectful, inclusive, and supportive environments. So this is definitely important. So when we talk about stress, I think the issue of stress, many times we tend to ignore and minimize because COVID is a physical illness. So we tend to focus mainly on these physical issues. But importantly, so every now and then we need to remember what are these emotional impacts, what are the constant worrying, the difficulty in focusing, the difficulty on, on concentration, your motivation. All of those are signs of stress that we tend to minimize. And because we minimize or ignore, we do not pay attention on the importance of managing our behavior, on the importance of the impact of the stress on children. I think it's important that we pay attention to that children do have, go through stressful times, that they do. In the Caribbean, sometimes people will tend to say, well, I'm the one working, I'm the one, going to taking care of the family. Why would they be stressful? Well, children do suffer from stress. And we know that because then you start to see behaviors that are very concerned, difficulty in sleeping, bedwetting, having stomachache, being anxious or angry. So all of those are very relevant, and during the conversation, we can continue more in discussing how do you support your kids in a more, in a healthy manner. So mental health and psychosocial needs are very important for both parents, teachers, and children. We need to make sure that it's important that we structure our day, that there is a way for us to manage our anxiety, and importantly too, for parents and even for teachers to explore, when you talk about self-care and modeling adaptive and mood behaviors. What happens here is that we tend to we are very good in teaching our kids how to brush their teeth, how to comb their hair, how to wash hands, but we're not good in teaching them sometimes about their thoughts, about feelings, of managing their feelings, managing their emotion, and have, helpful communication techniques. I think this is very important. This is an opportunity. I think that's one of the things with COVID, that we want to be able to use these times to build and develop resilience. So here we're talking, that's my time, so I need to stop here. So I'm wrapping up. So important is Number one is good taking care of yourself. It's important to take care of your relationship, and then important learning to tackling problems. I think those are things that we want to focus. I still have 1 more minute. So one of the things that we are also encouraging is how many schools you know that they are actually investing in building on mental health literacy, and you know, kids that spend an average of 25, sometimes even 30 hours per week in the classroom. So here is the importance of having mental health literacy in schools, because we want the teachers to be able to have the capacity to see if there's any problems, and then learn to refer these kids. And we are not asking that teachers diagnose, because that's not their role. Their role is to teach, not to diagnose. They have people who are specialized to do diagnosis. So I want to thank you for the opportunity to be part of this panel. I think COVID provides an opportunity for us to build back better and to ensure that mental health and well-being are integral part of school programming and services. Thank you.
Thanks so much, Claudina, for that presentation. I think one of the key messages that I want to highlight is we already had an issue pre-COVID, right? There was an underinvestment, and that is something that we need to acknowledge. And as we build back better, be sure that we address this really important issue, and you know, with strategies like mental health literacy in schools. So thanks for that. So before we move into the panel, we're going to have a little feed break. We've been sitting for half an hour, so we're going to have video from Danielle Walwyn, who is HCC's advocacy officer and has created a wonderful choreography to help us move. So I'll leave you with the video.
Good morning, everyone. So we have been sitting down for some time, so we're actually going to stand up and we are going to be moving a little bit just before we proceed into the rest of the program. And so physical activity, which is what we're going to be doing, is known to have many health benefits, immediate as well as long-term. So I want you, before we begin, to think about how you're feeling right now, and then we're going to do a check-in at the end of the fit break. So for our fit break, we're going to be doing 4 different movements targeting our head, arms, upper body. We're going to be moving our hips, and we're going to be jumping from side to side, okay? So I'm just going to demonstrate. So we're going to be going 4, 3, 2, 1, 4, 3, 2, 1, lifting the knees up for 4, and jumping 2, 3, 4. And we're just going to be repeating that.
We're going to be using PAHO and CDB's jingle, look, listen, and link. So as we're doing this fit break, really listen to what the words are saying. Are you ready?
Be ready to look, listen, and link. After catastrophe or disaster, look, listen, and link. Because we are stronger together. It's okay to talk about how you feel inside. Shows the strength you have in you to make it all alright. Look out for the children, women and elderly, so all of them know, you know just how they feel. Be ready to look, listen, and link. After catastrophe or disaster, look, listen, and link. Because we are stronger together.
You think about others, but don't forget about you. Listen to your brother, and he will listen to you. You're never alone. Don't accept no violence. Reach out to your neighbor. Don't suffer in silence.
Be ready to look, listen, and link. After catastrophe or disaster, look, listen, and link. Because we are stronger together.
This message is brought to you by the Pan American Health Organization and the Caribbean Development Bank.
So I don't know how you're feeling. I'm feeling, I've got a smile in my face. I can see other smiling faces. And I hope you feel energized after this fit break. Thank you so much, Danielle. That was great. So I'll hand over now to Pierre so he can get us started with the panel. Over to you, Pierre.
Brilliant. I too enjoyed that fit break. It was really nice. And I completely enjoyed those 2 presentations we had, and I like the links that we had between the actual structure of protecting our children and their health from COVID, and then a conversation about protecting their mental health and well-being. And in that same vein, we're going to have some panelists come on to have a bit of a discussion. And the first person we're going to talk to is Jara. Now, Jara is in sixth form, or actually leaving sixth form. Jara, I'm going to invite you to say a bit about yourself, and then we'll continue with our discussion.
Hello, everyone. My name is Jara Cave, and I'm 18 years old. I'm here to give the student perspective on mental health in the time of COVID. As Pierre would have mentioned, I recently graduated from sixth form at Harrison College, and I was supposed to start my first year of university this September, but I had to defer because of COVID-19.
Yeah. Now, Jara, I know that, I mean, I'm at university, you just left sixth form. It's kind of a weird time during the lockdown, making those changes. And especially for a lot of people, it's like, what do we think about for the future? And I know with someone like you, leaving your final semester of sixth form during the height of COVID and the lockdown period even, what were some of your major concerns during that time, especially looking forward?
Yeah, this was a very stressful time, the third term, because there was so much uncertainty with my exams, and I was kind of working towards a scholarship, so I wasn't sure when my exams would be, if I would even have exams, what format they would take. My SBA tests were pushed forward and then pushed back, so it felt like I really couldn't get a hold on kind of my academic, I had a plan, and then it was just kind of thrown into the air. So I couldn't really get a hold of that. And then also there was the added part of being afraid of contracting COVID and not being able to complete my exams like as I would normally. So it was generally just very stressful. I also found learning online really difficult because we had to like suddenly switch to these lecture style Zoom classes, which were really, I feel like I've heard my friends say that it feels like watching a YouTube video, and it's easy to feel a bit disconnected from the content. Yeah, and it's easy to be distracted because you're on your computer, and like Twitter and Instagram is like literally a click away. And then there's like being disorganized. I remember in multiple occasions, I was eating my breakfast in my first online class. Like it was easy to just feel demotivated and like you were falling behind academically, and those feelings were really difficult to deal with.
I can understand that, and I think all the students listening in, and I hope the parents and professionals listening understand that even though we're like this technologically, this group of teenagers who are connected on the internet, it was difficult for us to switch to a kind of online learning space. It was stressful on our mental health in terms of structuring our lives. And I mean, even looking now, I just started back university classes, and I mean, you've deferred your first year of university, but given the COVID experience, given what you experienced during the last semester, this radical shift to online lectures, and the many concerns that you and some of your peers might have had due to this system, what are some of the things, the major things that you think students like yourselves, what kind of support do you need from your parents and probably the school system at this time? What kind of support can they offer you to make this a smoother and easier transition?
I think one of the most important things is having varied approaches to learning. And this is, I think, one of the things that is already apparent in our school system normally. But with the online approach, with the lecture style classes, it's very monotonous and kind of easy to tune out, especially for children with like learning disabilities or who may not have a visual learning style. I found myself being distracted and like falling behind and just not feeling like I was giving my all to a class just because it was the same thing over. So I think things like maybe giving students handouts, like colorful handouts, or preparing games for the classes, or having like more, like sending audio clips or something to keep the students engaged throughout, and not just you come to a class and you sit down and you listen for the whole time. I think it will also be important for the coming year for teachers and parents to kind of do regular check-ins for students, just to see where they are mentally. And I think this is specifically important for the younger students. I know for me, I've had 6.5 years to kind of get used to dealing with my schoolwork and like emotional stuff, whereas new students maybe coming into secondary school or primary school children, they don't kind of know yet how to manage that. So I think students and parents and teachers checking in and just letting the students know that they're supported will be very important.
Yeah, that's always important, and that's always an important conversation to have. And I think you kind of underscored some of the experiences that other students might have had in terms of being anxious during the COVID lockdown, you know, being anxious about what it means to adapt to this new learning system. I know people are talking about a new normal, and it has been a new normal for us in terms of how our classes are administered. And I know that we had to develop very quickly ways to deal with stress and anxiety. What are some of the effective strategies that you might have used in the past or you're hoping to use in the future to cope with this new learning system?
So I have a few like personal tips that I found really helpful, because the primary feeling for me last term was just feeling demotivated. And I think sticking to a regular routine where you're kind of preparing as you would for a regular day of school really helped me to just get in the mindset. So things like waking up early, eating breakfast before your first class, keeping a planner, even if you don't normally do it, even just planning something to do in your lunch break or getting up and moving during the lunch break, because there's that whole like virtual fatigue where you're just sitting in a chair and your day is just sitting down, and it's easy to feel like mentally tired and lethargic like that. So just small things like keeping yourself to a routine that you would normally. And then I think also just continuing to be social, even if it has to be online. So things like study groups with friends, even if you're not normally used to doing that in regular school, maybe having like a Zoom study group to just stay connected, kind of remind yourself that you're doing this with other students and you're not alone. Yeah. Is very important.
Yeah, and I think part of that conversation, I mean, you highlighted some things that I'm experiencing, even at my university stage, fatigue. I get so tired from being on classes. I'm literally sitting down and taking classes, sitting down and looking at a screen, but I feel mentally and physically tired. And I think that's kind of strange for some parents, because they're like, you know, you're just sitting down looking at a computer, but it's different. It's the fatigue of it all. And lovely tips in terms of having a planner, organizing your life, and the brilliant idea of having Zoom classes online. Now, Zoom study groups online, I didn't hear about that until yesterday on Twitter, which is important because this peer-to-peer type exchange about what can help and what doesn't work is important. Now I can go and hit up my friends and be like, let's have some more study groups online via Zoom. Jara, thank you very much for this conversation. We're going to have you here. You're going to be on for our question and answer segment as well. So anyone who has a question, you can leave it in the question and answer box. I'll hand over to Dr. Prieto for our next interview.
Thank you so much.
Thanks so much, Pierre and Jara. Those were really great experiences and suggestions. I really love the tips, Jara, for how to deal better with that virtual fatigue. And now we're going to move to hearing a different perspective. We're going to have with us Nikisha Rain. She is a mom of 4 and a very accomplished professional. So I would like, Nikisha, for you to start telling us a little bit about yourself.
Hi, good morning, everyone. Thank you for having me a part of this panel. It's a pleasure to be here and to share some tips and some of the best practices that probably I've witnessed around me in this endeavor in terms of getting children prepared for back to school. So I am by profession an international trade policy specialist. Currently, I am corporate development manager with the Insurance Corporation of Barbados Limited, ICBL. And I'm also a lead strategist with the international NGO Homeward Bound, where I facilitate strategy training with a group of women from all over the world with a STEM background. So I'm a pretty busy mommy, doing all of that and having 4 children who range from ages 14 to age 7, 2 girls, 2 boys, 2 teenagers, and 2 younger primary school age children.
Wow, that's quite a bit. So, Nikisha, it would be great if you can start by sharing with us your experience in navigating this new normal and these past few months and what is coming ahead as both a mom, but also a working woman and a professional. Can you share with us some of those experiences?
Okay. Yes. So I'm not going to lie to tell you that it was easy and simple and, I just had it all together and put it all out there. in the first few weeks of what this COVID was, or what is, we were trying to come to terms as a nation with what we'll be doing, and looking at every other country around us, try to address this matter, and incidents of persons contracting COVID coming into the country, all those different things were starting to come to the fore. And for me, I had to start thinking, Nakisha, should this come to Barbados, or should the country decide to shut down because other countries were shutting down? What would you do as a mother, as a parent? So my husband and I, we discussed, what should be some of our approaches, and immediately, and I'm thankful that I have the resources, but immediately I went out and I got devices for all my children. We started to have more conversation with them in terms of, this disease and what it looks like, even for us in terms of how we interact with people. In the Caribbean, we are popular, it's a common practice to hug and to kiss and to, you meet a stranger for the first time, it's like, hi, how are we doing? So it's something that it takes away from our socialization, and I had to think about, what would I do? What measures would I put in place in order to get my family ready for any uncertainty or any adversity in the country?
And what are some of the key things that did work for you and for your family? What are some of the strategies that you can maybe share with others that really made a difference in looking back, and that you are planning to continue to use as we go into the school year?
Right. So as simple as I would say, as simple as in the morning time, what was happening is that the schools, they were no longer, at the time, they're still trying to just coming together and doing assembly on mornings. And as simple as that, I saw it important to set the atmosphere within the home, because now my home became a classroom. It's not designed to become a classroom. My children had to move from having a living room with chairs that they sit on and hang out and watch television. And now this is the room that becomes table and chairs and computer equipment, and you have to be quiet. So I had to, in the morning time with my husband, we set the atmosphere for what the day is going to be like, ask questions. So what do you have on your schedule today? We go into prayer because we are a Christian family. So, we set the right atmosphere and the right mindset for what the day is going to look like, even though it may be a challenging day. And, encourage them to speak, encourage them to come to us if there's any concern. And we do our best to communicate with them and ensure that they are prepared for whatever day that they have. Another tip that we followed is like Jara said, having a schedule. I think this has made me even a more organized person than I was before. So in terms of wake up times, breakfast times, classroom, when classroom's supposed to start, when school ends, because it is important for them to get outside and run around, and then having breaks in between, and even scheduling their times in my work day. When I have meetings and Zoom calls and conversations with execs, I had to negotiate and navigate all of that. And a lot of it is conversation and understanding within the home. And then having the village, it's so important for grandparents and neighbors and whoever that you can tap into to assist in this time. It's really important, that village, that support, that network.
Nakisha, and I can certainly relate to some of the challenges that you are speaking to, specifically that kind of blurry line between work and home when you are sharing the space, and then it's difficult to make that switch, right? But I really like how you emphasize routine again, and this is something that Jara also offered as a thing that worked for her, kind of making a very explicit effort to structure your day so you don't get carried away with the virtual fatigue or with that confusion, especially for small kids, I think, of being at home doing schoolwork. And if you're home and working from home, then why are you not available for me? Why do you have to work? So I think that structure and that open conversation is a really great tip. So just to end, can you share with us some ideas or some thoughts of how you think parents can be best supported by governments, by schools, even by peers, by other parents, or like community, like you were saying, it really takes a village. Can you give us some suggestions around this?
Right. One major suggestion I would have, and I think I've been seeing it in Barbados within the business community, with some businesses who are better able and better equipped to support their employees. Frankly, in my company, in ICBL, we have had flexible working conditions with the understanding that one, we want to limit any infection or any cause of any infection within the business. And also two, we do have parents who have children, and you know, with the flexible work from home and then you have school, go face-to-face school learning, we do have to, you know, cater to their needs as well, and ensure that the productivity and that type of thing in our company is maintained. So what my company has done, we have been maintaining flexible working conditions, work hours. Your workday is not necessarily 8 to 4. We have different departments that persons may choose to take care of their families during the day, and they work probably 12 to 1, 2 o'clock in the morning, with the understanding that, you know, they probably would only switch on a little later in the day. You know, those type of discussions and understanding from management is important, and I'm hearing the conversation among the unions, among government, and among the education, you know, the different stakeholders within the education system. So that's one area. Another area, I would have mentioned the village. I'm hearing about schools where even the churches, the community centers are being used for classes. So this is where conversation moves out into the community. So it's no longer just the principal and the PTA or the government. It's so much the government can do and think of. We as a community also need to see how we can make things work with what we have. So I know of some churches have opened their doors for classrooms. Community centers have opened their doors for classrooms. So these are some ways in which, in the age of social distancing, in the age of where you have schools with limited resources, the church and other social organizations are coming together to help schools and parents and foster, you know, a easy transition into what this new normal is.
Great, thank you so much for those thoughts. And I think every crisis can bring opportunities as well, right? So this is also an opportunity to open a much needed conversation about how can we better, especially for working moms, right? Make working and caring for your family work. So maybe these are conversations that we should have been having, and this crisis really is offering an opportunity to put those important issues on the table. So we're now going to move to our last panelist, Ms. Harriet Leedy, who is a counselor with the Ministry of Education of Antigua. So Harriet, good morning. Thanks for joining us. And if you want to start by telling us a little bit about yourself.
Good morning everyone. So nice to be with you today from beautiful Antigua. I work with in counseling department within the Ministry of Education, and I work a lot with student support and providing support to different schools, to different students specifically. Great,
thank you. So I think this is the perspective that we were missing, right? The perspective of the teachers, counselors from the school side. So it would be great if you can start by sharing with us some of the challenges that you have seen in students during this time, and really, you know, across different social and economic groups, because we know, as Claudina was highlighting in her presentation, that really COVID is putting a spotlight on inequities and gaps that already existed there and that are only becoming wider, right? So if you can start sharing your experience in this regard, that would be great.
Wonderful, no problem. So we have reopened schools since the 7th of September, actually. And so some of the issues and some of the major concerns resolved mainly around anxiety levels, and I believe Jara mentioned some of that before. Students just navigating new protocols, looking at students with comorbidity issues and how they're really able to cope with the changes. For some students, the school plan is their area of comfort, and so there have been changes in the school plans. A lot of frustrations with good internet service, that's also a big issue. And using the devices as well, having the device and the internet service to navigate the blended learning. And so we have in Antigua a blended learning situation where students are at school. Some students go to school at certain times. For example, students are at school Monday, Wednesday, Friday. If you're first and second form or not, the class third and fourth would maybe there Tuesday, Thursday this week, and so it's rotated. And so those challenges and just getting accustomed to those new norms, new protocols in itself is an issue. And as you mentioned, socially as well, some dysfunctional areas we may have issues in, where some students who are accustomed to be at school every day, they now have to stay home some days, where school was their source of comfort, where they would get meals from, where they'd probably be able to talk to a teacher. So there are challenges along those areas, as well as looking at how flexible you are as a student, how well you're adjusting to your protocols. And also for students who are concerned about socializing, and that was mentioned earlier as well, just that freedom of the regular school community and what you're accustomed to do, the school-based activities that you're accustomed to, things that have to be changed, like in sports and after-school activities, independence celebrations, at least for us. And those changes themselves, all those pose challenges to students and their ability to respond to the changes that we have presently. And you know, what happens now is that the students with socioeconomic challenges, they would tend to stand out. You know, I don't have a device, or I don't have internet at home. And those are major challenges for students who may, for example, for meals, should I be on the list, or do I want to have my meals? Is it a public thing or a private thing? And so those as major challenges, as well as parental expectations. The students are home so they could do more chores, or they could babysit the siblings. And so we've seen a lot of those challenges thus far. And I suppose we have also spoken about some of these challenges before as well.
Thank you, Harriet. I think those are great insights into the reality of what you're seeing from your end, and some of the challenges that are kids who are eaten in a blended context, similar to what we have in Barbados, or children who are entirely attending school virtually are facing. And what would be some of the coping strategies that you would recommend or suggest that can be utilized in the classroom to mitigate some of these challenges that you have described?
Okay, some of the things we can begin to look at is the term we came across during we had parental psychosocial sessions during the summer during our lockdown. And I remember one presenter shared that we must be an emotional scientist and not an emotional judge. And so we need to ask questions about children, ask them how they're feeling, give them time to respond, and don't assume too quickly. So we give our students an opportunity to share, to debrief, to talk about how they're feeling. Good communication also helps to regulate the emotions. Having students in psychosocial settings, whether they're in HFLE or they're able to go to the counselor's office, and just to talk about some challenges that they may be having. That also helps in terms of creating strategies to help them cope better. In cases where we have parents who are co-parenting, this is something that has to be stepped up. I mean, the communication definitely has to increase, because now you're having a situation with blended learning, and parents need to communicate. And whether you're co-parenting or both parents are home, you really, really, really need to co-parent and to do it well, and especially for the educational purposes. And another thing we need to remember too is that, you know, when emotions are very high, cognition is low, and our ability to think and to process and to make wise decisions, that's significantly reduced. So it's very, very important to deal with those emotions. So especially this time, dealing with COVID, we really, really have to look at our mental health, what we're able to provide at a school level, what we're able to provide at a community level as well, so that we can have persons being able to share how they're feeling and be able to deal with the normal stresses of the day and the added stresses that may come from responding to changes of COVID. So we basically need to help our population with the flexibility needs, persons who are having challenges at school, compared with work, working out time lags between parents and students, and having proper supervision as well for your children. Very, very important coping strategies that we can look at that would be effective at the classroom level.
Great. Yeah, I think good communication is coming throughout, right? And good communication at home, good communication in the classroom, good communication with your peers, and really leaning on others, as Jara was suggesting with those Zoom study groups, which I found is such a great idea. So just to end, can you share with us what are some ways in which we can create a supportive environment in schools?
Okay. When we begin to look at the schools, Jara mentioned it, routine. One of the things with change is that we have to try to make sure we maintain normalcy as much as possible. And so understanding and communicating to our children as they learn and develop through their lifespan. I mean, we're looking at different ages of children who are adjusting. And so we have to maintain routine for all levels. Structure is important. Structure is good for brain development. And so we have to maintain the structure, create the rhythm, have the children learn that rhythm, and also communicate with their parents, other students and teachers as well. I think I mentioned this already, listening to the students. It's very important to me. The teacher is experiencing the change. Everybody's experiencing the change in the compound, but we tend to have a way in which we tell students what to do, and we don't necessarily listen to them and listen to their perspective. And students can be very creative. We can help them, they can help us to create those healthy spaces for learning by telling us what's comfortable for them. Teachers as well, they have to be, and my heart goes out to teachers really, because it's so much changes and they're right to the heart of all the change, the face-to-face, the Google Suites, and being on top of everything, being on top of your topics that you're teaching, etc. Monitoring and evaluating. Some of this comes from at home, but we did an important exercise today. We got up, we moved, and we sat down. That is actually very good, because when we're learning, the blood is going to settle somewhere in our lower body, and actually getting up in 20 minutes and moving around, because we may be using the computer or we may be stuck to our desk. It actually helps the blood to go back to the brain so that learning can continue and it can be effective. So those are good measures that we can look at for classrooms as well. Very important. Keep communication clear. We said that before. For teachers, especially in the classroom, don't assume that the children know how to handle Zoom. We literally have to teach, especially at the primary level. When do I turn on my mic? Go have a session that deals with teaching them how to handle, where's the camera, where's the microphone, what am I speaking at? And so that would increase efficiency and good communication and Zoom sessions, because as we said, yes, the times are uncertain and we don't know if we face another lockdown or not. We literally don't know. So we need to make sure that these things are very, very effectively learned so that can be maintained afterwards. Also having good mentors, role models. They're a way of dealing with different types of students. And sometimes it would be important to have those mentors and role models, because not everybody at home may be techie and savvy, and you may need that other type of guidance and that type of help. Look at working out and having healthy relationships as well with each other. Healthy relationships. We still need to work on our relationships. We still need to be a part of social groups. It could be online social groups, etc. I think Jara mentioned that as well. Very, very important. And the face-to-face and the blended learning, that face-to-face provides that opportunity for the teacher to build that relationship with the student, which we know is very important for learning. And so when they're at home, then that relationship would also be maintained, and the respect and everything that goes with having a healthy relationship with your teacher. Very, very important at this time.
Great. Thanks so much, Harriet, for those thoughts. So again, routine, structure, good communication, the important message of digital literacy, we take it for granted, but I think you're making a very important point in that we must not assume everybody knows how to use Zoom, or everybody knows what's the potential for a mobile phone, the things you can do if you don't have devices for your children. So I think that's a very important point. And of course, the issue of mentors, role models, and ensuring that children have healthy relationships even as they are out of school. So thank you very much to Nikisha, to Harriet, to Jara. Those were great contributions from the real experts, the parent, the counselor, the student. So I will now hand over to Pierre. We have already 11 questions and we have half an hour for discussion, questions, and just exchanges of comments and feedback. So over to you, Pierre.
Thank you. Truly enjoyed that discussion. I think you all highlighted very important areas of this conversation that we need to have about building back better. How do we exist in this environment? How do we safely protect our mental health and ensure that we're as productive as we can be? And I mean, Dr. Prieto, you kind of mentioned the importance of digital literacy. And even with our first question that we have here for Dr. Caetano, it also speaks to mental health literacy, which is important. We always say that, you know, digital literacy, we need to understand that if we need to exist and develop in this COVID environment. But if we're going to protect our mental health, we need persons to develop their mental health literacy. So the first question is from Siobhan Lowe to Dr. Caetano, and it's basically, should mental health literacy be included as a critical aspect for the teacher educational curriculum in training at this time? Should that type of mental health literacy be included in teachers' training?
Thanks a lot, Pierre. Definitely, I think this is something very, very important that we need to include because, you know, literacy is so important for everyone. Literacy is very important not only for teachers, for the media, for parents. This will help for us to be able to reduce the stigma, to be able to help people to have, you know, seek help when they need to without feeling that they will be judged and they will be stigmatized. This will also help to be able to have people have the conversation about mental health and decrease, not to have them to be suffering in silence. It's okay to go to the dentist. It's okay if your tooth is hurting. It's okay to go to the doctor if you're not, if you have, you know, like fever, cough, and you have some signs of maybe some physical illness. So you do that. So this is what we want. This is what to build that literacy. So I'm glad that you're asking the question. We need to make sure that it's embedded in teacher, you know, in the Caribbean, you have the life skills training. Part of that, we could include mental health. Thank you.
Thank you very much. And I mean, continuing in that vein of mental health literacy, protecting the mental health of not only students and teachers, Ms. Lydia, I'd like to ask you, so more and more we understand that teachers are also becoming overwhelmed with the increasing communication, emails that they're getting to get their lessons organized. And we even have teachers who are complaining and saying, oh, well, I'm moving from a situation where I'm in charge of my classroom to students sitting in front of me, but the parents are behind and they're also, you know, kind of examining my teaching skills, and there's more pressure on teachers. What advice would you give to teachers in terms of coping with, you know, this new development, this new type of teaching, and this new aspect of delivering their lessons?
Okay, that's an interesting question, though, with the parents being a part of it. I've actually said that these times are quite interesting because parents have often wanted to be a part of the curriculum. They wanted to know what the children were learning and how they were moving forward, and it's exciting. Certain boundaries are very important now in your classroom, in your Google Suite, etc. Because just as we are thinking about, you know, providing good digital training, that is something as well that needs to happen. I know in Antigua we did that. We had there's an opportunity for parents to learn along with their child or separately, how to use the Google Classroom, how to set up an email address so that you can have the email coming to you, you know. And so we want to encourage parents not to be like a helicopter, but to support what the children are doing and give the children that opportunity to interact with their teacher, give the teacher that moment. But from the teacher's perspective, they would need to set those necessary boundaries, and if there are administrative issues that can be worked out at the school end, then they should also look to do that as well. Very important.
Which is important. And I think looking at this new development, looking at teachers setting boundaries is different. Boundaries will be different. Your boundary is now, I turn off my camera if I don't want you to see what I'm doing in a particular time. So boundaries will look different, and it's all about developing not only the personal capacity to set those boundaries, but the literacy, the digital literacy to know how to turn on and off your cameras, how to turn on and off your mics, and then mental health literacy and understanding why this is important for you to keep yourself sane.
It's also important when you talk about cameras, we're talking about dress codes. Yes. And you can't be having breakfast. There has to be some sort of regulation. Yes, I'm having breakfast, but am I in my T-top? Or am I just jumping up because, oh, I have on my pajamas? You know, so there has to be some of that being worked out at the face-to-face level with the child, communicating that with the parent as well, so that those begin to form as some of the protocols in terms of using the type of classroom that we have to use now.
Pierre, can I add something to what?
Yeah, sure.
I really like what she said in terms of your heart goes to the teacher, right? Goes out to teachers. The teachers are also parents. Teachers may also have, you know, some kind of pre-existing conditions. Teachers could also have added pressure, not only from mental health, from everything else. So I think it's so important that we keep the building the trust that has to be between the parent and the teacher. That trust is so key to be able to support the child, because kids are sensitive. When the kid sense that the parents are not comfortable with the teacher, you know, that's where the acting would come. So I really think it's important to build that trust. And I'm not so sure this would be an opportunity for another question, but I think it's also important for the schools to have policy when it comes to mental health and psychosocial support. It's not just a conversation, but that there is written policy in terms of how that would be managed. Thank you.
No, thank you. Very, very important. And I think thinking about those new ways that we're looking at schools and developing within school systems and existing within a school. I mean, the school has literally become your house. The classroom has become your living room or your study room, which is very, very different. And we have a question for Jar. I'm going to pose this one to you, and it's something that I've been thinking about for a while. Children who are transitioning into secondary school. From Zita, she said her son is transitioning into secondary school in a few weeks. What advice would you give to her in terms of supporting her son to develop friendships in the absence of a social context, in the absence of being in a classroom, making new friends online? How can we navigate that, Jar?
Yeah, I think that's one of the things that's really tough with like not being in school. But I think as a parent, maybe doing things like forming parent groups to meet the parents in your son's year, so that you can kind of connect that way and not necessarily rely on your son to be making the effort to form new friendships. That way it kind of takes a bit of the pressure off of him in terms of he might be a bit nervous to introduce himself in like online situations. So forming those parent groups, also like ensuring that your son has access to like being able to continue the friendships. So I'm not sure where you're from, but if you're in a place where you can meet up, maybe scheduling like play dates or stuff outside of school, so not necessarily relying on the teachers to assign group projects or something like that, but kind of taking the socialization outside of school.
Thank you, Jara. This speaks again, I mean, even for me, kind of finding the balance between being online in classes and then having the opportunity to socialize, which is important. You kind of highlighted that in your presentation as well, the importance of socializing and having that type of engagement. brilliant idea in terms of parents meeting together and kind of scheduling. I feel like parents can meet together, discuss how children can socialize in a different space, but a safe and structured way. Now we have another question about parenting. So balancing homeschooling, teleworking, and this person is speaking specifically, Stephanie is speaking about, she has a spouse who's on the front line, and it was a major task in terms of developing and working around that type of environment. How do you as parents keep the balance between work and family, as well as keeping your mental health intact, as well as making sure that you're okay? How do you manage the two, managing the children, managing your work, and managing your mental health? Nikisha, I'm gonna put this to you.
Oh my, there's no one standard answer for that, or one size fit all for anyone. But for me, I tried various things, even from exercise. You know, we took exercise out as a family. You know, we did, my sons, they're into cricket. So whatever drills they would have done it in their cricket clubs, they brought that into the home. So we were outside, I was doing drills with them when I can. My younger daughter, she's into dance. So whatever dance moves she was learning online, I was doing it with her. So there were so many different little things that we did in order to deal with, you know, that mental break that you needed from the everyday and the online and the stress of it. For me, I probably had to get up earlier, and at first I would have been a little bit more tired, but I had to say, you know what, I need my space. And I had to communicate that to them. So I needed to give me half an hour and let me go for a run, literally. Let me go for a walk. And then eventually what I started to do is include, because I have 4, I started to include them into that whenever I felt that I could have. So I probably take everybody for a walk, and we'll go for a run together, you know, just to, it was an intense day. You are a parent, you are working, you are IT specialist and advisor to parents who don't know how to work the system, and you're trying to help them online as well. So it's literally changing your environment, coming out away from wherever the stress is, and breathing. Even as simple as, if you can't go far, you don't have an open place to go run or go walk, literally coming outdoor and just saying, breathe in, breathe out, and give the day another chance. Yeah.
If I may, if you don't mind, Pierre, for me to jump in.
Yeah, no, fine.
I really want to emphasize what Nikisha just said in terms of self-care and making a conscious effort to secure a little time for you every day, even if it's less than half an hour, just to have that sense of I have time to do something I like. And it can be anything you like, anything you enjoy, that gives you a sense of having, you know, a space where you can enjoy and relax. That's really, really important. And it doesn't have to be anything special, like Nikisha, you were saying, maybe just going for a quick run, or I love sewing. So that's what makes me feel like I disconnect, and I try to do a little bit of sewing every 15, 20 minutes a day, and have a little project that I'm working on. So those small things can go a long way in not making you feel trapped in the routine of kids and working. And so I just wanted to emphasize that. And maybe, Pierre, that there's a couple of questions in the chat about tips for single parents. And that's, I think, a big challenge. So I don't know, Nikisha, Harriet, Claudina, who wants to take on this one?
Elisa, I wanted to add one more thing. Single parents, married parents, it's important for us not to be too hard on ourselves, especially in this circumstance. I think, yes, there are days when I feel that being a parent, I shouted at my daughter and I shouldn't have, and then I have to go apologize. You know, you're human and you're feeling different emotions. They are feeling different emotions. You have to take them into consideration. And you may not always do your best. And it's sometimes when we harp on our failures, that tends to be a distraction, and a distraction away from how we can think about other ways, other positive ways to, you know, get up, dust ourselves again, and let's try this one more time. So I just want to say to our parents, you know, for everybody, teachers, parents, you know, caregivers, everyone. This is an unusual time, is an unusual period of our lives. We never could imagine that we'll be here, even on a Zoom call, talking about ways to cope. You know, let's not be too hard and tough on ourselves.
Agreed. Thank you so much, Nikisha. Cannot be too hard on yourself, and you have to exercise intentional self-care. That is very important. When it comes to single parents, definitely, you need a plan. You need a routine. You need an effective structure. And also, one of the things that you definitely need is to be able to look at the long range, look at the future, look at what's happening. Have to exercise more positive behavior management and being a bit kinder, because a lot of times we assume the children don't get stressed. We assume that all of this is not affecting them. And sometimes we have to stop to observe the change of behavior of our children, to really recognize the impact that all of this is having on them. And the exercise and the routine, that's important, because one of the things that happens when you set up a structure is that you begin to look at your time management. How much time are they really spending focusing on the computer? How much time are we spending outside? And we still have to take them outside for their large muscle development. We still have to work on all those varying areas, as well as dealing with our own personal issues. My heart really goes out for persons who are frontline workers, persons who have to have babysitters or take them to a particular place and then go to work every day at a high risk. That is difficult. And support, when we begin to talk about mental health, it is something that we don't pay enough attention to, but at work, there needs to be debriefing sessions. So you take less of it home. And then at home, I believe Elsa just said that, you have to take a break for you. Must take a break for you, regain yourself, refocus, encourage yourself, and have that support system as well. Maintain that social support system, whether that social support system is going to be virtual, and then people are going to encourage you to keep doing what you're doing. Very, very important. But we have to watch our levels. We have to watch our levels, and especially children. Children normally get ignored at this time. They look at, looking at their stress level and what they're doing. How are they coping? A lot of our teenagers were not coping very, very well with the changes with CSEC and the different things that were happening there. There were some issues there, and so I noticed that Dr. Claudia wants to jump in, so let me pause and give her opportunity to jump in.
No, thank you. Actually, I just want to say you have to learn to pick your battles.
Yeah.
No, if anybody knows me, you know that my heart is so excited. I'm very happy because we're talking about mental health, and this is, Elisa, you know how important it is, and I'm really appreciative of this moment that we're paying attention to the importance of taking care of ourselves first, and I have that in the PowerPoint. So when you receive it, you will see that number one is you, and then your relationship, and then how you handle conflicts. Thank you.
Kind of continuing there, very important question I want to pose to you, Dr. Boisson, just in terms of the structure of protecting children and the policies and the environments that we're looking to put in place to ensure it's kind of like far-reaching, includes everyone. So considering students who are particularly vulnerable, so students who may have special needs or who have a low literacy rate or have limited access to online platforms, how do you think we can go about ensuring that they have equal or equitable access to this type of information, or that they're at least considered in the development of protective measures for children at schools?
That's a very good question. And when I started my presentation, I said that the school is part of a wider community. And even in the wider community, we're now recognizing that there's some really distinct challenges that disabled persons face, for example, and it goes against some of the safety measures. So use a mask, but what about persons who have to lip read? How can they communicate if they have to use a mask or lip read from somebody who's using a mask, for example, or sneeze into the crook of your hand? But what about the blind person who holds your elbow to be able to walk? So there's some serious considerations we need to make for disabled persons. And I can tell you that those first came to the fore when we spoke with disabled persons. And so in the same way that we're having discussions here with parents and students and teachers, I think it's important to bring the disabled students into the discussion, because there will be some needs that they have that we may not even have thought about. We have to hear it really from them. I think though, even without speaking with them, that sense of community and taking that special effort to make them part of a community, whether it is by having some sort of buddy system with another student who can virtually hold their hand along as they move through the virtual platforms, maybe one way that we can try to keep them as part of a group, maybe their closer community being a little bit smaller with a couple other students with them.
Thank you, Aldona. I think I love that message of participation, right? We really need to hear from those who are going through these experiences to understand what's the best way to provide support, right? So thanks for that reminder. And Jara, there's another question for you, and it's about how have you been coping with the loss of the social aspect of school, and which is a big way of releasing stress from the academic pressure, right? So how have you been coping with that, and really with the social restrictions that COVID has brought, and what are some of your thoughts or tips for those who are listening who?
Yeah, I think for the most part, I try to stay connected to my friends via social media more so than I would pre-COVID. I think it's like important. I have to mentally set a reminder to myself to just message my friends that maybe I don't talk to every day, but who I would see at school and pass when I'm walking to class and be like, hey, how are you? So to just send them a WhatsApp message or send them like a video clip or something just to check in on them. And I think that has helped me a lot to just remember, even though I'm inside a lot and I'm not seeing them, that they're still there and I can still talk to them. So definitely social media. And then also just like planning like the study groups, or even there's this app called Cast where you can watch movies virtually. So you can like set your screen and share it with friends. So me and my friends do that a lot. We like play the movie and watch it together, and then we'll like talk via the like social media and the chat. So just, I guess, finding like online games or different social things that you can do to stay connected and remind yourself that you're not, that even though you might not be engaging in the same way you would previously, you can still engage virtually.
Yeah, and I think I want to chip in here too, Jara. I feel like just during the lockdown specifically, just getting a message from a friend saying, hey, Pierre, how have you been? How's it going? Was so important to me. And recently, some of our friends, since we've started back campus, well, online classes really, they've been reaching out just to find out, just before an assignment, how are you getting through it? Is it difficult? But how have you been generally? So those are some of the tips that I would ask, other youth or young persons or students to kind of engage in before you have to do an assignment. If you get a new project to do, just check in with your friends to see how they're getting through. Ask them generally how they're doing, send them tips. If you find a video that's helpful, send them that video that helps them to really understand the information better. I found that it was really, really significantly, it helped to improve how I felt going through the classes, and it felt a part of the community. I think we have room for just one more question I'll include in here. Which again, it speaks to us, Dara, just looking at how we've been coping with losing the campus life and the fact that we haven't returned to our classes. And just to kind of continue on that point, since I started university, what has happened is social distancing is in place. So in the cafeteria where we would normally hang out and chat and de-stress after a class, we can't do that. So what we look to do is meet up in the library and have classes with the social distancing protocols in place, have these online class sessions, and have these socializing meetups where we watch a movie to de-stress. So parents as well who are listening to the call, if you can encourage your children, over the weekend when classes are over and they don't have a big load of homework, maybe you and your friends can watch a movie together online, maybe you and your friends can play a game together online. It helps us to de-stress, and that's very, very important. I'm really, sorry, go ahead.
I was going to say, I think as well, since we're not I think it's easy to forget that just because you're not seeing your friends every day and you're not socializing with them in the way that you used to, that there are still other ways to do it. So like Zoom is you can get so many people on a call. My friend's birthday is coming up and she's doing a Skype games night. So things like that, like what Pierre said, just kind of to mentally remember that you can do other things other than what you would normally be used to.
Yeah, no, thank you all for engaging in discussion. I'm really sure that everyone on this call got something that they will take away to help them, whether it's on mental literacy, digital literacy, kind of protecting yourself first, and then looking at your relationships, and then that wider conversation about your society around you or the community around you. The importance of students kind of tackling down, organizing yourself a bit better, but keeping connected not only through the social media, but finding ways to reach out to your friends and understand how they're feeling. Parents as well, supporting your children, your students, your classroom now that you have to develop and their learning experience, and also the very, very important COVID-19 protocols that have been put in place in our schools, and the fact that they need to address not only those who are able to go out there and take care of themselves to some extent, but the most vulnerable as well. Really, really happy to have had this discussion. I'm going to pass on to Maisha, who I think is going to give us our closing bit.
Thanks, Pierre. So keep your camera on because we're going to get key takeaway messages from each of you, all of the panelists as well as the moderators before we close. So let's start with we'll start with Dr. Prieto because she's also a mom and she's the mental health advisor. I'd love to hear her key takeaway message.
So my key takeaway message is self-care. Make time for yourself. And that I think applies across the board. Students, parents, teachers, make time for yourself. It doesn't have to be anything fancy, but something that belongs to you. And I am going to steal Nikisha's key message of don't be too hard on yourself. And that's part of being kind to oneself and that self-care need. So that's my takeaway. Over, Maisha.
Love that, thank you. And let's go on to Dr. Boisson. Can we have your final takeaway message?
Sure, thank you. So it's an unusual time, it's an unusual year, but I guess my message is try not to panic, try to go with the flow for the while. This too will end eventually. Don't panic, prepare to be safe. Listen to the recommendations, follow the recommendations. There's been a lot of discussion about online interaction, and at some point that too will end and you will be doing face-to-face, and there'll be concerns about engaging with people face-to-face again. But don't panic, listen to the recommendations, prepare, and be safe.
Thank you. And let's move on to Dr. Cayetano.
Thank you very much. This has been a great opportunity to be part of this session. There were questions there on youth attending university. So I want to take the opportunity in my last, in this moment that we do from PAHO and UNICEF have on Wednesdays a youth hangout. So I don't know if Pierre has participated in that because I remember seeing it.
Yes.
So youth hangout is about my formula. What's your formula in coping with COVID? So maybe we can share that with some of the colleagues who say that they would like to know a little bit more about youth. In terms of my last comment, I think for me it's just that we need to keep the conversation going on mental health. The opportunity of building back better, the opportunity of ensuring that mental health and well-being as integral part of school, that's I think is the greatest legacy we can leave for our children. That now we can talk about mental health in a safe and responsible way without have to be feeling stigmatized or bullied. That it's okay to talk about your mental well-being. Thank you.
Thank you. And let's go on to Harriet.
Oh, beautiful. My takeaway would be stay in the boat, be flexible. The boat is rocking, stay in the boat, be flexible. You know, you would have to change one way or change the other, but don't come out of the boat, stay in the boat. The boat represents life, it represents our experiences, and we are sailing through, but we just have to be flexible with the changes that we are experiencing.
Thank you. And Nikisha.
Yes, so when I listen to the conversation, one word comes to mind, and that's resilience. We have to be resilient in this time. Being resilient is being agile, being flexible, and when we don't know, when we feel that we don't know what we have to do, let's tap into your resources, tap into your network, tap into your support systems, and get the help that you need.
Thank you. And Jara.
I think my key thing would be to take everything in baby steps. Like, you need time to adjust to online, so give yourself the time. You're not gonna do amazingly in an online class like the same way you would in an in-person class. So just kind of come to terms with that and let yourself adjust and try and go back to basics and let yourself have the time that you need to get used to everything.
Thank you. And Pierre.
I think my message would be to the youth on the call. I think I want you to check in with your friends, checking with your strong friend, checking with everyone. We really need that peer-to-peer support, in terms of checking on their mental health, giving them tips. And then when you've realized that you've come to a point where you can only give so much support and no more, point them in the right direction of speaking to a guidance counselor, seeking a professional, but checking on your friends. That's my message.
Thank you, Pierre. So I would like to thank PAHO for your ongoing support, and thank you to all of our excellent panelists and our team behind the scenes, Danielle Walwyn and Carrie Barker. And finally, thank you to all of you who tuned in to hear regional perspectives on this important topic. And so as we close, let us think about what next. We certainly hope that we have triggered a conversation about mental health, which brings us closer to removing some of the layers of stigma around this very important issue. One of the silver linings of COVID is that people, including children, parents, and teachers, have begun to more openly speak about anxiety and stress and express feelings of loneliness and isolation. So hopefully this increased dialogue, we can begin to mobilize as a community, stronger together, and advocate for greater investment in mental health policies that create safety nets to support and promote good mental health in our schools, our communities, and our societies at large. And lastly, as our presenters and panelists have said, don't forget, be kind to ourselves. Thanks again for your continued support. Stay tuned on HCC channels for our next webinar, and please complete the post-webinar survey. Enjoy the rest of your day, everyone.